Hello everyone, I am Amal Abulia, the Behaviour Specialist in Barking and Dagenham Community Learning Disability Team. I am going to talk about what does a behaviour mean, covering what the behaviour is, why people with learning disabilities engage in challenging behaviours, functions of behaviour, how does the behaviour happen, and what to do. What is a behaviour? Behaviours are everything we do, all our actions and our movements. Think of this. Now I'm talking, this is a behaviour. You're watching or listening, this is another behaviour. All behaviours happen as a reaction to receiving information through our senses from the environment. This means that behaviours happen within an environmental context, and therefore all behaviours are learned and happen for a reason. Keeping in mind what behaviour is in general, now let's talk about challenging behaviours specifically. Behaviours in which the intensity, duration, or frequency is affecting the person's quality of life and potentially puts the person or other people at risk. Examples of affecting the person's quality of life include affecting their safety, their ability to take their ability to take part in leisure activities or perform daily life activities, or for example, create a barrier for the person to learn or acquire new skills. Such behaviours can cause distress and create difficult situations to cope with for the carers. Why do people with learning disabilities engage in challenging behaviours? There's no simple answer to this question, but we all know that behaviours happen for a reason and in an environmental context. So first thing to look at to decide how we can support is to look at the reason why challenging behaviours are happening. People with learning disabilities have limited communication and social skills. If they do not acquire most of these skills from a young age, their needs and their wants will continue to be there even when they're older, but with no skills to communicate it. With this limited repertoire of skills, they might use challenging behaviours to get what they want and to satisfy their needs. Also, as a result of having limited social and communication skills, people with learning disabilities have limited choice and control over their lives. Imagine yourself not being able to decide on your day-to-day schedules or activities, for example. Could be very frustrating. So challenging behaviour can be a very effective way of changing that and gaining that control. It's always important to remember that challenging behaviours are not planned or deliberate. It's simply a result of a learning history. What that means is that these behaviours have been effective in the past to meet a certain need, and that is why they're still happening. We'll go over how learning a certain behaviour happens and become a pattern later. So we spoke generally about why behaviours happen or challenging behaviours happen. Now we will go over a list of possible reasons. First, underlying health conditions and physical pain. People with learning disabilities are more likely to have other health conditions than the rest of the population. For example, some syndromes like Down syndrome are linked to heart conditions, respiratory problems, or dementia. My colleague Sarah Hall spoke about how challenging behaviours could possibly indicate dementia last week's webinar. Uncommunicated needs and wants. This could be a continuation of the first point. So people with learning disabilities might have difficulty communicating pain. Challenging behaviours might be a result of them trying to cope with discomfort. They also might lack the social skills to ask you to have a chat with them when they're feeling lonely, or sometimes just simply ask for a cup of tea. My colleague Sam will explain communication further in the webinar. Sensory needs. Some people with learning disabilities are sensitive to specific things in the environment, such as noise or lights. Too much noise, for example, could distress a person with learning disability and could lead him or her to try to escape the situation and to avoid being around people as much as possible. Sudden changes. We all can relate to this now, given that we're all affected by the lockdown measures. It could be hard for a person with learning disabilities to understand why they have to stay at home, or why they have to wear a mask, or wash their hands frequently, or queue to go to the shop. Some people with learning disabilities struggle with even smaller changes, like changes in their daily life routines, like changing their meal times or changing the type of clothes that they wear, that the weather is a bit warmer now. Struggling to cope and adapt to sudden changes could result in challenging behaviours. Lack of structure and routine. This is again similar to the previous point. Constant change of routine and having no structure for the day, for example, could lead to confusion and distress for some people with learning disabilities. Lack of choice and control. We touched on this point previously. Again, due to the lack of communication and social skills, people with learning disabilities have little control over their day-to-day schedules and activities, which could lead sometimes to challenging behaviours. Lack of meaningful activities. People with learning disabilities sometimes lack the ability to occupy themselves. Boredom and lack of preferred activities could lead to frustration. Mental health issues, past trauma or abuse. My colleague, Dr. Binney, covered this topic in more detail, so we know that people with learning disabilities are just as likely to have mental health issues as everyone else. Although we just spoke about many reasons why people with learning disabilities would engage in challenging behaviours, the following purposes or functions are the most common. We've got attention, tangible, escape, sensory, and medical reasons. Attention is to attract any kind of attention from others. Tangible is to get certain items such as food, objects, or activities. Escape is to escape or avoid situations that are uncomfortable or unpleasant. And sensory is when the behavior is related to the sensory needs of the person that we spoke about previously. So what's happening in the external environment is not as important when you're looking at sensory behaviors. It's usually related to the person's internal needs. Medical reasons and physical pain. This is similar to the underlying health conditions that we covered previously. So challenging behaviors might be distressing. Always remember that they're always serving a function, and these behaviors are probably an effective way of getting a need satisfied. Now, I want you to think of yourself when a person next to you is chewing food loudly and it is annoying you. There are a few effective options for you to escape this situation. You could move away, you could ask the person to chew quietly, or you could flip the table. What you choose to do will depend on the skills you have and your general state at that time. But all options will result in that person not chewing loudly. We will revisit this example later. There are situations where challenging behaviors are more likely to happen. Understanding setting events, triggers, and consequences will help you provide the appropriate support. Setting events. These are events that result in the person being generally more stressed, less responsive, and less tolerant, and more irritable. These are also called slow triggers. Examples of setting events or slow triggers are not getting enough sleep, feeling hungry or thirsty. Setting events in the lockdown could be related to not seeing family or friends for a long time, or losing a family member or a friend. These events might occur hours, days, or weeks before the incident of the challenging behavior. They make the person more sensitive and more likely to engage in challenging behavior when behaviors are triggered. Triggers. These are the events that happen immediately before the behavior. You might have heard of them as antecedents. Common triggers are demands, being told no, denied access to something wanted, sometimes a particular activity or person if previously paired with unpleasant things. Triggers in these difficult times could be being asked to wear a mask, or having to wait in a queue to go to the shop, or being asked to wash your hands before touching face or food. A good way to understand setting events and triggers is to imagine yourself, for example, one morning, you woke up late and you didn't have your coffee. This is a setting event. You're more likely that day to find the construction noise outside your flat more annoying, which in this case could be a trigger. Understanding setting events and triggers shows us that the reason for challenging behaviors are why challenging behaviors are happening now won't necessarily be the reason why it started. Consequences. Consequences are what happens after the behavior that makes it likely to happen or not happen again. Challenging behaviors are maintained by the consequences. So back to the example we spoke about, if the person next to you stopped chewing loudly after you flipped the table, you're more likely to do it again in the future because it was an effective way of escaping the situation. We'll take a look at this visual now that explains what I just said. We've got the setting event or the slow trigger. In this case, we could think of someone who is having a headache or feeling tired. When we have the trigger that happens later in the day, this could be a person asked to wear a mask when they're outside. After the trigger, the challenging behavior happened or the incident. And then what is following are the consequences that maintain the behavior. For example, the person is comforted, taken home, or he doesn't have to wear a mask anymore. Now, this is where the learning happens between the behavior and the consequences. If the behavior was effective for the person in the future, when a similar situation happens, they're more likely to do this behavior again because it was effective the first time to escape the demand, for example, of wearing a mask. Let's try to revisit the escalation cycle that my colleague Kate went through earlier in this webinar. As you can see near the amber line, this is where setting events and triggers happen right before the behavior. The consequences happen after the behavior, or the crisis as referred to in this cycle, and happens between the red line and the yellow lines, where the behavior has stopped now and the person had got what they wanted, for example. Now, to avoid repeating this cycle and creating more and bigger learning history through the consequences, we always recommend using proactive strategies to protect the person with learning disabilities, such as communication, activities, structure, and routine, which my colleagues are going to cover later in this webinar as well. What you can do to understand why a behavior is happening. First, physical health checks. It's very important to rule out underlying medical conditions. As my colleague Binny mentioned before, uncommunicated pain and discomfort is a lot of the time the reason for challenging behaviors. For example, a sudden worsening in the behavior could call for a checkup with a GP or nurse. Common conditions we see that could result in challenging behaviors are ear infections, toothache, constipation, urine infections, or seizures. Mental health checks. Again, as we mentioned previously, mental health checks are equally important and have to be explored and receive appropriate support. Sensory assessments. In some cases, sensory assessment are needed to understand the person's sensory needs to help them with their challenging behaviors related to their sensory needs. And lastly, functional assessment. If concerns about challenging behaviors persist, a functional assessment by a behavior specialist and other members or other professionals on the community learning disability team could determine the reason for the behavior and provide the support needed. These are, again, some useful websites that you can find for more information about challenging behaviors. Thank you for listening, everyone. And if you have any questions, please write them in the chat box.